Welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Special guest today, Latasha Holmes with iCare Pediatrics.
Hello.
How are you today?
I'm good.
Tell us about the iCare Pediatrics concept.
iCare Pediatrics came about, I would say, probably like 3 years ago when I first came out with the name. I kind of wanted to, like the whole iPhone, like I really care about the patients and the pediatric population. I was just doing virtual visits like a year ago, and then I decided to take it to brick and mortar. So I do extended hours. I'm more like a personal concierge. I go to your home and will visit your kids if they're sick. So, yeah, something to my heart.
What made you think about that? The whole mobile aspect of bringing healthcare to the people instead of the other way around?
Because some people just can't make it into the office. You have parents that have like 5 kids and like, oh, this is a lot to bring all my kids into the office. So offering something that's more comfortable for them to come into the house. And a lot of kids do better in their environment, and they're more cooperative too when they're in their own home.
So how did you get into pediatrics to begin with?
It was God's plan. I've been in the whole pediatric field for 14 years as a nurse, and I've always just loved it. So I invested my career, became a nurse practitioner. I just love kids. I'm good with them. Tell
the audience about what a nurse practitioner does, because I often prefer going to a doctor's office and seeing the nurse practitioner. Tell us the subtle differences there.
The subtle difference, I would have to say, well, because we go to nursing school, we learn a lot more bedside manners, and we learn holistic care. We learn just trying to get to the patient's level at being able to explain what's going on. So I feel like we do exactly what a doctor do, but just on a different scale because we're governed by the nursing board. So diagnose, treat, do referrals, look at lab results, everything.
And let's say somebody has a son or daughter that wants to get into your field in particular. Kind of talk about that career path and what they need to know about getting into nursing and nursing school and then taking those next steps.
So it's so many different avenues to even get to where I'm at. Some people start off and just become a medical assistant just to see if they like the healthcare field. From there, then they'll go maybe get their LVN, which is a licensed vocational nurse. It's like a year program. Some people go and get their associate's degree, which I did, and which is a 2-year program. And then you go get your bachelor's, and from there you go get your master's. It's all in the nursing whole track. And so it's a hierarchy of more of events. And the highest level is your doctorate degree, which I'm still pursuing.
Okay. So how's that going?
Oh, it's going.
A lot of work?
Tons.
So when do you find time then to do your business?
I find time to do my business all the time. Like I have a whole lot going on. I have 2 daughters, so I'm able to just multitask and kind of move stuff around to get everything done. Yeah, it's a lot of work.
And so you started this business 3 years ago, you said?
3 years ago.
So you had a good opening, and then all of a sudden the world shut down?
I didn't have an opening far as like a brick and mortar. I just more really branded my name, started doing pop-up sports clinicals at various places, then started offering online and doing televisits and going to homes. And then I was like, oh, I really want to be in a place where I can see more patients, take more insurance, and be more accessible to my patients. So that's why.
So what have you kind of learned along the way, a piece of business advice you could throw out to
insurance, billing, coding, all that is very different and difficult. I mean, talking to the insurance companies myself, not having a biller to do it, I'm doing everything. It has been a learning curve. I mean, I'm loving the journey, but it's very stressful.
So hopefully at some point you'll be hiring or
yes,
outsourcing.
I'm hopefully once my patient population pick up, I'm definitely hiring a biller. That's hands down.
And that's a. Do you know? Can you talk about that a lot? Because I think that's probably a good entry level job for people coming out of school.
Yes.
And I hear good things about it.
Right now, I am training a nurse practitioner in my clinic who's also in school for her master's in nursing. And I have a medical assistant as well that I'm training too in my clinic. So I'm hoping that by the time she finished school, I can just hire her on, because I'm training her everything that I want her to know, and how to use my system and how to take care of patients the right way. So, yeah.
So talk to me a little bit, and we talked about this before we got on camera, your use of social media and your marketing efforts. I mean, obviously, to get patients, you've got to get noticed. How do you go about doing that?
A lot of posting. I try to at least post a post every day. I try to change up my posts because people get bored with seeing the same thing over and over. I'm really big on becoming my brand and just really pushing my brand out there in so many different ways, giving reels, doing like little snap videos, getting my patients on camera. Right now I'm about to put a commercial together, and I'm gonna have all my patients that come and see me come and be a part of the commercial. Just really branding my brand, pushing iCare out there. I brought a billboard that was up for like 4 months. So yeah, just kind of being very noticed.
And you're noticing it pay off? You're seeing the growth?
I am seeing a huge growth by posting on social media.
Okay.
I mean, I will post on my Facebook page and get at least 35 people to share it just because of who I am.
That's great. Those are really good numbers.
Yes, it is. I was floored.
So tell us maybe a story, obviously without names, of one of your patient interactions where the whole concept came together and you were like, yeah, I knew this would work, and this is why it worked.
One situation, I would have to say it was a patient that I took care of, and her mom brought her in because she was feeling sick, and mom said that she started sleeping more. And these are those aha moments that I'll be like, oh, I'm so good at what I do. And she was like, she's sleeping more. She's just feeling tired and everything. We tested her for everything in the office. And I was like, let's test her glucose, and see, just to make sure that's good. And I said, do diabetes run in your family? And she was like, no. Test her glucose, and all it said was high. Test her urine. She had like all these ketones. So I had to call her in to go to the emergency room. And she was in what we call DKA. But mom was so called me in tears and was just thanking me that, you picked up on my daughter and you didn't just let her leave. You saved her life. So those moments is what I live for. And I'm able to, I don't want to cry, impact my patients that way and really become a part of their family. Like, they will come and just sit in my office just to talk to me, some of the parents. I just want them to, that, hey, I'm here for you and we can all get through this.
Yeah, my mom was a nurse, and they have a particular skill set that really, the way they connect with patients.
Yes.
And
yes.
We've talked about this on the show before, that not all doctors necessarily have that same ability, but it seems like most nurses do.
Yes. It's just, I think it's just like we understand, we really try to get into their mindset and their family. So
before this, talk about how nursing's changed for you over the years.
Oh, nursing changed dramatically over the years. I know when I was a new nurse, it was always like the nurse would eat, like the older nurses would eat their young. Like, they were just really not out there to help you to grow. I feel like new day and age, we have a lot of people that's really helping nurses, educate nurses, mentoring nurses. It is right now hard for nurse practitioners who is in school finding places to do clinicals, especially pediatrics. It's really hard. You have some providers that want to charge them, and that's really hard on people that's trying to go to school and take care of their family and work, and you're already in your career field. So it's changed a whole lot. And I want to be that platform. I wanted to start an agency where I can help people find clinical sites. I just don't have the time. But it definitely changed.
Yeah, talk about how important the clinicals are, because we've heard that in other conversations we've had in the community with healthcare providers. Is that where the magic happens? That's where people really hone their craft?
Yes, that's where the magic happens. That's where you get that exposure. That's where you learn how to go from being just a regular nurse to a nurse practitioner and changing your mindset on diagnosing and treating those diagnoses with the proper medicine and dosing, that's where you're going to get bulk of your learning from. And if you don't have that clinical site and you can't get that clinical, you can't graduate. It's a lot of nurse practitioner students that had to drop out of school because they couldn't find a clinical site that will let them train. And since COVID, a lot of people stopped taking in students.
Well, hopefully that's changing, and we can get people back into their clinicals.
Yes, because we do need nurse practitioners in the primary care settings, because a lot of other physicians wanted to go back to the hospital, and so we need that other level of care out there.
So you're doing this kind of in the Clear Lake, Bay Area, Houston area. Talk about what the need is, if you can, in rural areas, especially a nurse practitioner might be a good fit in a more rural area where doctors are kind of hard to find.
Definitely need it. I know it's a clinic in Beaumont. I can definitely speak on that, see over 200 patients a day, because it's no healthcare there. Like, it's hard to find healthcare. I wish I could open a clinic there, but I just wouldn't have the time to drive there and really build that practice there. So yes, we need healthcare everywhere. And, eventually I can probably expand my business and be able to open more locations in those areas that really need that good healthcare that they can rely on.
Speaking of areas, where are you located?
I'm located in Webster, Texas on 218 West Nassau Parkway. So you can come and see me, Suite B. It's a big iCare Pediatrics sign. My hours are 8 a.m. to 8 p.m. So I have that flexible time. I do house calls. I just seen a patient Sunday and went to the house to see the patient. I'm able to test for strep in the house, flu, COVID. So it's just like you would have came into me in my office.
And it's great, because if a kid is sick, the last thing you want to do as a parent is bundle them up, put them in the car, drive them someplace. And you don't want to go to no ER and sit there and wait or anything like that.
So
it's a great concept. Hopefully your business continues to grow and you can bring other people into this. And is there anything else you want the audience to know before we part?
I'm excited to be in the Clear Lake area, in the Webster area. I've always practiced more in the Houston area. So all my patients are Googling me and finding me. So definitely, come by. I do take private insurance. I do take some Medicaid insurance. So, and my cash visits are really a low price.
Awesome. Well, thank you very much.
Thank you.
The Clear Lake Area Chamber of Commerce is here to support all businesses in our community. Every May, we do an annual Business and Wellness Expo to showcase you. If you're interested in participating on May 12th, go to clearlakearea.com or call the Chamber office.